This is a patient of temporal headache on left side, not responding to medical management. So today we will do diagnostic Sphenopalatine Ganglion block and see whether this is effective or not. So patient is in supine position. First we will see in AP view and then in lateral view to see the VAS, and then we will clean tape the patient. You can see the VAS behind the maxilla. That is the area. We will open it up. Just do the some more adjustment and should be okay. Can you see that? Which is okay. Okay. Now we will clean drape. Now we are looking at the patient in lateral position. We can clearly see the inverted VAS there, and mouth of the patient has to be open. Now we will enter through the coronoid notch and go towards the Pterygopalatine Fossa. Now we have seen that we have entered the VAS in lateral position. Now we will attain the depth in AP position. So our position is perfect. We have gone inside and it is in the lateral wall of the nasal cavity in the maxillary sinus. Now we will again see in lateral view and inject the dye. We see we are in the middle of the VAS and it is perfectly seen. Now we will inject the dye. We will inject the dye and see the spread of the dye. So dye is inside also, right?
Yes.
And coming out also. Let us see in AP view. Now we will inject the medicine. This is local with dexamethasone. Ropivacaine with dexamethasone. I have injected 2 ml and the needle is out. Okay. So this is all. Yesterday we did the diagnostic block which turned out to be positive. Patient doesn't have any pain right now. So today we will do RFA of Sphenopalatine Ganglion. So I have already clean draped the patient. We are seeing the patient in lateral view, and if you see nicely we can see the inverted VAS just behind the maxillary sinus there. So we will enter into the VAS in the lateral view. First we will feel the condyle, then come anterior to the condyle to feel the coronoid notch. It is just below the zygomatic arch. This is the coronoid notch I can feel. So I will mark my entry point over this. Yeah, that's okay. And then I will give local. In Sphenopalatine, you have to go out of plane because the coronoid notch is lying posterior to the Sphenopalatine Ganglion. So I have given local. Again I will feel the notch here. Now for this we will take 10-5 RFA needle. It is yellow in color, 5 mm active tip, 10 degree bend. First we will enter the notch as such. I have entered the notch and the direction should be like this, anterior and medial. So we'll see where I am going. So first we will nicely square and see the notch. Yes. Now we will redirect the needle towards the Pterygopalatine Fossa. Yes. Yeah, our direction is correct. So we will go. Yeah, we are going towards the VAS. We will try to enter into the middle of the vase. As we can see here, we are not going towards the roof. We will try to enter the vase in middle zone. So this is where we will enter. Okay, I am hitting the bone. Yeah, I have entered the vase. Yes, so we have entered the vase in the middle. Now I will slightly go towards the roof. Okay, relax. Yeah, that's fine. Give me an AP view. So depth we will attain in AP view. Now we confirm the position in AP view. If you go back to the screen there, so we have entered the vase and we are on the outer edge of the nasal cavity. This is where we think that our ganglion should lie, because if we go more medially, we can puncture the lateral wall. So this is the perfect condition, perfect position. Now we will stimulate and ask the patient where the pain is coming. Now we will introduce the electrode. Now we will do stimulation and ask the patient where he is feeling the pain. Now we are doing sensory stimulation. Start, and patient will feel pain at point 2, and we have asked the patient is feeling pain on the back of the pharynx. So, and patient is not feeling pain over the distribution of inferior orbital nerve or in front of the nose. So we are perfectly placed and good stimulation achieved at point 2. Now we will inject the local and do the conventional RFA for lesion. So we have given the local 1.5 ml, and now we will wait for 1.5 minutes and do 4 conventional lesion at 80 degree for 90 seconds in all the 4 quadrants. Now we are doing the RFA. So 10-5 cannula and needle is perfectly placed. Stimulation is perfectly achieved, and you can see both AP and lateral view, perfect views. And then this is the 80-90. We will do 4 lesion at 80 degree centigrade for 90 seconds.